In this video, we'll be discussing about the contraindications of ultrasound. So, the first one is uh, vascular condition. Conditions such as the thrombolyptis, where insunation may cause emboli to be broken off or not treated with the ultrasound. And the next one is acute sepsis. An area which presents acute sepsis should be treated cautiously with ultrasound because of the dangers of spreading the infection, or in some instance, breaking of septic emboli. If the treatment is passed over an infected area, as in the treatment of herpes zoster, say for an example, it must be sterilized with an appropriate solution before treating of next patient, or it may get infected to them. And the next one is radiotherapy. Radiotherapy has an deviating effect on the tissue, therefore, ultrasound is not applied to a radiated area after 6 months of irradiation. Next is tumor. Tumors are not insulated because they may be stimulated or metastasized. Next is pregnancy. A pregnant uterus is not treated as the insemination may cause damage to the fetus. Consequently, during pregnancy, the back and the abdomen should not be treated. Cardiac arrest. Patients who have had cardiac disease or treated with low intensities in order to avoid sudden pain, and areas such as the cervical ganglion and the vagus nerve are avoided because of the risk of cardiac stimulation. Patients fitted with a cardiac pacemaker are not usually treated with ultrasound in the area of the chest, as the ultrasound generator may have an effect on the pacemaker's rate of stimulation. Hemorrhage. When bleeding is still occurring or has only recently been controlled, such as an enlarging hemarthrosis or hematoma or uncontrolled hemophilia, ultrasound is contraindicated. Severely ischemic tissue. Because of the poor heart transfer and the possibly greater risk of atrial thrombosis due to statistics and endothelial damage, ultrasound is contraindicated. Nervous system. Normal doses of the ultrasound have been applied for many years to the tissues around the spinal cord without any ill effects. In fact, treatment of the spinal nerve roots and over the apophyseal joints is particularly common. Since the CNS is deeply buried beneath the thick muscles and more importantly bone tissue, it seems reasonable to support that only travel amount of energy could reach it. Where the nerve tissue is exposed, say for an example, over the spina bifida or after laminectomy, ultrasound is contraindicated or totally avoided. Specialized tissue. The fluid filled eye offer an exceptionally good ultrasound transmission and retinal damage could occur. Treatment over the gonads, example testes and ovaries, are also not recommended. Implants. Although metal implants in the tissue would reflect the ultrasound at their interference and thus leads to more energy absorption in this area. This does not lead to a large temperature rise in the region because the amount of the heat generated is easily conducted collar areas. The effect might, however, be different with the smaller and more superficially implants with metal bone, fixing pins subcutaneously placed as a precaution. Low doses are used in these areas. Plastics used in replacement surgery as high intensity polyepithelial and acrylic should be avoided since their effect on ultrasound absorption is unknown. The last but not the least effect is anesthetic area. If ultrasounding is given to an anesthetic area, there will not be any type of pain or heat experienced by the patient, which could lead them to burn. And that's it, guys, for today's video. Hope you guys learned many informative things and stay tuned for the next one.